Guys, welcome back to Medical Coding with Blue. Today's episode is all about exploring the CPT manual and some things you should know. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So the CPT manual. Now, this is all of the outpatient procedures and evaluation and management. They are all housed in this book. This is the book that I use. And if you are taking any of the medical coding certification exams like the CCS, the CCA, the CCSP, or the CPC, they all require us to have the same book, right? Which is the AMA CPT Professional Edition. Now, depending on the year that you're taking your exam, or depending on the time of year that you're taking your exam, it's going to depend on what year version you need. When you are signing up for your exam, you will be told what books you need and what books are allowed. It surprises me. It astounds me. The number of times I get messages from people that don't know what books that they need. Guys, you have to pay attention when you're signing up for your exams. It will let you know what books you need and what versions you need. So that's why when you're signing up, it'll let you know. And you have to just look at that, okay? But everybody has to have the same CPT manual. Now, I use this manual regardless, okay? Because there are other publishers not taking an exam, right? But there are other publishers out there for CPT. However, I prefer this one hands down every single time, okay? And that's just what I recommend. Now, before we get into this, into the rest of this book, something I want to show you guys here. So on the inside of your inside flap here, there are a list of all the modifiers, right? But not all modifiers can go on all CPT codes, okay? So, but these are the ones that you have to know about. It'll tell you a little bit of a description of what it is. It'll also give you a legend up here to let you know what the symbols are, right? And here is your tabs. Now, I have always said this, you do not have to tab your books. I did demonstrate how to tab the CPT book a few days ago, but only because I get so many requests to do that video. That's the only reason that I do it, because otherwise I will never hear the end of it. So that's why I did it. And then I hear, well, Blue, I'm surprised you showed us how to do that. Guys, if you're going to do it, you may as well do it right. But I still say, and I even said in the video, that I did not want to do the video, but I do it for you guys because that's what you want to see. So with that said, you don't have to have them. You see, mine is clean, okay? I took them straight off, straight away. But if you are insisting, they are here, okay? These tabs come with this book, so you can use the tabs that do come with the book. You cannot use homemade tabs. That is one thing that AHIMA is really big on. Now, AAPC, they're different. They have a different tabbing policy. But with AHIMA, they do not allow for homemade tabs. They only allow if the tabs came with a book, but you do not need these tabs, especially if you have been practicing, okay? So we're going to go to the back of the book. Here is the index, okay? So I'm going to start the index right here. So this is the index. This is where you look up all your procedure codes. And one of the cool things about CPT that is so different from the PCS book, the ICD-10 PCS book, and those are inpatient procedures, right? Which is something completely different from CPT. These codes are already all put together, okay? It's not like ICD-10 PCS where you have to put them together. These are already together and they're already ready to go. But one of the things that I wanted to share with you guys is, like, when people have asked me, well, Blue, I'm looking up an arthroscopic procedure. How do I look it up? So let's see, make sure y'all are in that thing. Okay. So anytime you have an arthroscopic procedure, an endoscopic procedure, or a colonoscopy, that's exactly the procedure you're going to start looking up in the first place. So if we have a patient who's coming in for an arthroscopy, we look right here in arthroscopy. Now you got to be careful because there's two entries here. There's diagnostic and then there's surgical. So what does that mean? Diagnostic means that they need to go in and they need to find out what's going on. It's not exploratory, but it is diagnostic. They need to see what all is going in there. And so they're going to take out a little biopsy a lot of times. So that's the diagnostic part, okay? So it starts from elbow, and it gives you the code to kind of look at, elbow all the way to the wrist, all right? Then we have surgical. Now, surgical means that they're going in and they're repairing something. They're usually going in to repair something. So that's what surgical means. So they have surgical ankle all the way down to wrist, and it gives you a range, okay? So here, if it's diagnostic, it's giving you one code to look at. If it's surgical, it's going to give you a range, because there's a few things that change with certain body parts. Sometimes when they're doing a fixation, it's going to be 2 fragments. Sometimes it may be 3 or more fragments. So that's when we're going to look at the description of the codes, but we'll get into that in a minute. First things first. But just something that you got to be paying attention to when you're looking up these codes. So if you're looking at a procedure and it's diagnostic, you know that you're going to look at that first. Or if it is surgical, like they're repairing something, that's when you, okay, arthroscopic, surgical, and then the location, wherever you got to go. And then you look in that range, okay? And that's how you start to find your codes. But I do encourage you guys to take some time to look through the index, so that way you can start getting those headers in your mind of where you can find things, okay? And what kind of procedures are out there for you that you may potentially be coding one day, okay? So it's, again, it's a really great thing to go through. And it talks about, like here, for example, like blood vessels. And so it says blood vessels because that's the anatomical location, the blood vessel. Okay, then what are they doing? And so then you can say, oh, repair, or, you know, if they're doing a shunt creation, you know, that's also there. And so there's just different things, and you have just different categories and different headers and stuff. So there's lots of things, and it's not unusual to have more than one way to look up a procedure, okay? That's just how CPT designed their book. So take the time, and here we go with, well, that's a colposcopy. Where did I see colonoscopy? Colonoscopy right there. So there's colonoscopy, and then it'll give you like flexible, or it'll give you, or through a stoma. So really, you have to pay attention to like, what is the approach, right? And then we have, if it's a dilation, hopefully you can still see, dilation. If it's an exploration, we have a code for it right there. We have hemorrhage control, we have removal, we have ultrasound. So there's lots of things that can be with a colonoscopy. There's colon sigmoid. So again, we're going back to the anatomical location. What kind of procedure did they have? Okay, they had a biopsy, and it was done endoscopically. That's your code right there. And so we would flip there just to kind of verify that that's our code that we need, okay? And it continues to go on, but we have all these procedures, and you can really fall down a rabbit hole when you're getting into these, looking at these different procedures. Here we have our fractures, and it's all of this right here. So there's every single location, you know, and what kind of procedure are they doing, and some words that you have to pay attention to when you are coding for fractures, right? Let's just creep forward here a little bit. Okay, so look, we have the ulna, right? We have closed treatment. We have with dislocation, and then we have closed treatment, and then we have our series of codes there. With manipulation, without manipulation. So with manipulation means that they had to move the bone around to get it back to where it needed to be. Sometimes when fractures happen, that doesn't always have to happen. They don't always have to manipulate the fracture, because sometimes it's just a break and they can just kind of put the cast on and it's okay. So you'll have some with manipulation, and you'll have a code without manipulation. So if you don't see those words for the manipulation or like reduction, you don't see those, then you're going to code for the one without. Okay, so that's just something you got to pay attention to. It's all about looking at these codes, okay? So we have without, and here's your codes there. And then we have the different types here. And then we have open treatment of an ulna fracture, right? There's your code right there. We have the olecranon. We have closed treatment. and then it gives you a range of codes right there. And then we have open treatment, and there's the code right there. Then we have open treatment of an olecranon. Well, open treatment of an open treatment of an ulnar fracture right there, and there's our codes right there with radius. So sometimes it's not just the ulna, but it's also the radius as well. So they have ulna and radius, right? And then we have our code range here. And then we have open treatment, and then it's right there. So then we have the different locations. We have the shaft, the closed treatment, and then we have open treatment, and there's our code ranges there. Then we have the styloid process, and it gets very specific there, see? And then we have ulna and radius, open treatment, and there's our codes. So we see those codes quite a bit of times, right? So that's how you can look up the codes. And always pay attention to the indentions, guys. Now, sometimes the stuff is indented because it's just a continuation of the first code. Now, you don't have to circle. It drives me crazy when people ask me that. You do not have to circle, because to me, that's not using your book appropriately when you have to circle the codes, okay? Because if you're looking, you'll be able to see, okay? Now, because I'm starting to run out of time, because I fall down a rabbit hole, here we go. So this is something that I want to show you when it comes to learning to read the code, right? Okay, so we have the code 25608, which is open treatment of distal radial interarticular fracture or epiphyseal separation with internal fixation of 2 fragments. So you have to make sure that when you're reading the documentation, how many fragments are they treating? This happens like with comminuted fractures. Now, I have tangoed with a couple of my providers about comminuted fractures. So they go, Blue, this is common sense. It's going to be more than one piece. Yes, I understand it's in more than one piece. However, the code is different if you're only treating 2 fragments versus treating 3 or more fragments. Okay, so it really all depends on what you're telling me. That's why I have to know, well, that's just stupid because the comminuted fracture, again, I know what a comminuted fracture is. However, for the code's sake, right, which one did you do? So this one, this 25608 is open treatment of a distal radial interarticular fracture or epiphyseal separation with internal fixation of 2 fragments. And then we go down here and you see how it indents right here. So there's this little punctuation right here, and that's how we know, okay, this is with 2 fragments. But if we needed this open treatment of a distal radial interarticular fracture or epiphyseal separation, if we needed it with 3 or more fragments, internal fixation right here, that's our code. Because you see this indentation right here? This 25609, that's how we know to select that one if we have a treatment that's treating 3 or more fragments. And you're going to see that in the documentation, okay, in your surgery notes, all right? So that's just so you know there. But then watch these little notes here. So if we have this, all right, we're just looking at this code right here, the 25608 code. It says right there, do not report 25608 in conjunction with 25609, because it's already saying that even if they treated the 2 fragments, if they treated 3 or more fragments, 3 or more total fragments in the same area, you're going to use this code. You're never going to put these 2 together. It's going to be either this code because they only had 2 fragments treated, or it's going to be this code because they had 3 or more fragments treated, okay? So pay attention to those little notes right there, all right, guys? And then we have right here, 25609, it'll tell you again, do not report with 25608, 25609 in conjunction with 25650. 25650 is this code right here, a closed treatment of an ulnar styloid fracture. Because why? we're already treating. We're doing an open treatment. You can't do an open treatment and a closed treatment at the same time. That's what it's saying. You can't do that. So we have this. I'm trying to make sure y'all are still in the frame. Okay. Do not report that with that. For percutaneous treatment of an ulnar styloid fracture, use 25651. And then for open treatment of an ulnar styloid fracture, use 25652. So the parentheses is telling you more of the story. Okay. So I talked about a reference you guys can use for like the procedures in plain English if you don't really know which procedure code to use or what all is included in a procedure code. I'll talk about that here in a minute, but again, I want to kind of get through some of this other stuff. But paying attention to these indentions right there, that's really going to help you there, okay? Then we can go to the next one, which is the colorful diagrams that are in here in CPT. So these are the different, if you're coding for podiatry, and they have the different hallux valgus corrections, right? Then they have the hallux valgus correction with proximal first metatarsal osteotomy, and it shows you what it looks like. Okay, so this is a really good visual for those of you that are my visual learners. The hallux valgus correction with proximal phalanx base resection. So again, it's going to show you like what it looks like. So I always think that that's really neat. And the only way you're going to be able to find those things is if you take the time to go through the book. You can see those. And this, again, is in the musculoskeletal section. But these were where all like the podiatry procedures are. So it's really good to have that visual. And that's what's so great about CPT. Now, here, something that I wanted to show you. Okay, so when you have, a lot of people will ask me, Bleu, how do I know when to report modifier 50? How do I know when to report an RT or an LT? Obviously, if the patient has it bilaterally, you're going to use a 50 modifier instead. You're not going to use the right or the left, okay? Because no, you never do that. So, but here we go. So this one, for example, right? This says right here, 30903, right? Which is control nasal hemorrhage, anterior, complex, extensive cautery, and or packing, any method. And then it says right here in this little note right here for this procedure code, it says to report a bilateral procedure, use a 30903 with modifier 50. So it's telling you there that if it is bilaterally, you're going to add a 50 modifier to it, okay? Now, how do we know if we need to add a 50, right? On any of the other procedures? Because obviously that's not going to say it on all the procedures, but something that I wanted to point out and something that you all should know. If you see in the description of the procedure, right, that it has a directional in it, right, where it says that it is bilateral or it is unilateral, you do not report a modifier on it, okay? So right here, so for this one, I want to make sure, okay. 30801, ablation soft tissue of inferior turbinates, unilateral or bilateral, any method. This means that you do not report a 50 or an LT or an RT, okay? Why? Because it's already part of the description. Unilateral or bilateral, any method. So it's already including that. So we don't have to tell more of the story there, all right? So that's something that you have to know. So some of them, you're going to have to add an RT or an LT or a 50, depending on what the procedure is. But when you see that there are directional words in the description, that's when you do not have to do that, okay? So keep that in mind, another thing to keep in mind. Now, this one I wanted to point out. This page All right. So right here we see the resequencing, which a lot of people hate the resequencing, which yes, it is a little annoying. But so get this. So right here is a procedure code 43273, right? And then what if we need this code, this 43274? Well, we look here and we're trying to find this code, and it says code is out of numerical sequence. See 43264 to 43279. So we're going to go to 43264, which is up here because that's where our code range starts. And we are looking for code 43274. So it's not there, not there, not there. We go here, and it's right here. 43274 is right here. So why they do that, I don't know, guys. They just don't have them in order. I don't know. So, but that's how you find it. So whenever they say, see whatever range, you're going to go to that first CPT code right there, and somewhere in the middle is where you'll find your code, whichever code you need. Okay. And then I'm watching the time. So that's why you kind of hear me like stop. Okay, so let me give you one more thing to know about CPT. Here, what was I going to talk about here? So here I was going to talk about the add-on codes, right? Exactly, that's what I was going to talk about. That's why I marked it. Okay. So you see this little plus? That means it's an add-on code. This code can never be reported by itself. It always, anytime you see a little plus sign like that, it has to be reported with something else, okay? So basically, it's like a continuation on, right? And it says right here what code to report it with, right? Which can it be reported with? So it says use 92978 in conjunction with, and it'll give you all the codes that you can use it with. Okay, so if they did any of these other procedures here, you can report this code with any of these. Okay, so it's telling you right here which ones that you can add it on with. This code is never reported first. It is always reported after the primary procedure. So one of these, well, primary to it, okay, because sometimes they can have different procedures performed for different things, but really depending on what they came in for. But this is always going to go secondary to one of these codes here. So whatever things it says that you can use it in conjunction with, that's what you want to keep in mind. Okay, so that's how you're going to keep your sequencing straight. All right, is by knowing that the plus is never, these codes are never going to go first, and they're never going to be reported by themselves. They always have to be reported with their buddy. Okay, that's their buddy. One of these codes here is their buddy. All right. This little hashtag means that if you don't know what these things mean, when you go back up here to the front, this is why I tell you guys to look at your legend right here, right? The little hashtag means that it's out. Where is it? Okay, here we go. Sorry, guys. Out of numerical sequence. That's what that little hashtag means. So again, this is why this is helpful to know where this is. And that's how you know where to look, okay, when you're looking at these things. So that's our little exploration of CPT for tonight. Isn't this exciting? But I enjoy looking at these things. I just hope that you all are okay with the setup of this thing, because again, I'm not, tech savvy, but I just want you guys to see kind of some of the things that go on with this book, and hopefully this kind of helped you a little bit. And again, if you are getting overwhelmed with like a lot of stuff and you're saying, oh my gosh, I don't know if I can, it's just going to take some practice, that's all. But once you start finding your codes and getting them, and then you start getting on a roll, it's going to be an awesome feeling. So just hang in there, whatever you do, and take a look at the book, get familiar with it, and start looking at those appendixes. That's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.